Well, welcome back to the Good Medicine Podcast. I'm Dr. David Beers, the host of Good Medicine, and I'm here with my brother, Dr. Jeremiah Beers. Jeremiah is both a medical doctor and a PhD, physician, scientist, and I think maybe even most importantly for today's discussion, a father. So today we're going to talk about something that I think we're both seeing all around us, and I think everybody's seeing all around us, is that the young people in this world are really struggling with anxiety and depression and loneliness. And it feels like every family, every school, church, whatever, I think everyone's dealing with it right now. And so the question really is, what's going on and what's happening, and what has happened over the last few years to change this? So what's your perspective on the numbers of, in the last 15 years, how different it is than it was when you were a kid?
Yeah, I mean, and I think I had a little bit of exposure to this being in medical school. You kind of go through and treat every patient population, and you spend time with kids. They come into the hospital. But really, I would say even over the past 5 to 10 years, we've seen rates skyrocket. I think they've more than doubled is what the most recent data says and what the most recent kind of studies have suggested. And it's always interesting to say, well, what has happened in the past 10 years that has really kind of brought up these numbers? And I think there's any number of things you could point to. People talk about COVID, I don't think did anybody any favors. Yeah. So I had I think she was first or second grade at the time. And for a year, she was essentially isolated. Mm-hmm. And I think that had an impact on her, especially when she was developing. My other kids were all too little, so I don't think they really knew much of a difference. But I also think the number of conversations that people have face-to-face is significantly lower since the advent of cell phones. I think there's a lot of societal and other type pressures. I mean, I feel like my kids are so much busier than I was when I was a kid. I did sports. I did a lot of different things, but now it's like they're doing something every single night and they're doing 15 different things and they have pressure to do well. And I'm not putting that pressure on them, but it seems like they put that pressure on themselves. And I don't know where exactly that comes from or what's different.
Yeah. So it's fascinating. So today, I think what we'd like to do in our discussion today is to dig into why this is happening. I think a lot of people are interested in what role medication plays. It's something that we think a lot about, and how our brains and our bodies interact, what that means to mental health, and what real solutions might look like. So I think we can all agree that it really is at crisis levels. The number of hospitalizations for young people for mental health issues, self-harm, suicide, all of those things are very, very different in a negative way than they used to be just a few years ago. So I think we'll talk a little bit more about that and what's changed and what's driving it and what we know. But let's start with the big question is, we talked a little bit about, some of the things that have changed since we were younger. And, what's different about today. I think technology is probably one of the things that we point to that, around 2010, smartphones became a real thing, and social media started to come about. And, we started to do something that we never done before, that we had this different presence that maybe didn't reflect exactly what our real life was like, and the ability of young people, especially, to separate reality and fiction, especially when somebody's portraying something online that this is my real life, that it's maybe not, and people start to compare themselves to their classmates, to people that they look up to, people that they admire, celebrities, all these influencers that started to come out. Yeah, what does that do to a developing brain, right? I mean, as in a young child, that maybe, we know it takes a while for our brains to fully develop.
Like 25 is when they say that your brain is fully mature. Yeah. And so before that point, we're doing a great social experiment that we don't know what the outcome is going to be. And you talk to, I talk to my kids, and the people they look up to, it's not athletes, it's not like Mr. Beast is. My kids are all like, "Oh, he's so cool," and I'm like, "Why?" And they're, "Because he's rich and because he does cool things." So I was like, okay, but that's this persona he's cultivated online.
Yeah.
And so I think you hit the kind of the nail right with the hammer. We don't necessarily, everybody wants to portray having as good a life as possible.
Yeah.
And this idea of the old adage, comparison is the thief of joy.
Yeah.
Well, when you are able to paint this perfect picture of your life, and then people see that and they're like, well, my life doesn't look like that.
Exactly. Yeah.
And then you start to think, well, what could I be doing differently, or why am I not that good? And it's easy to, once you start thinking that way, and when your kids are on their cell phones from such a young age, when they have all of these different images coming into their feeds, I mean, directly to them, I don't know what's going to happen. Like it's crazy. It's
fascinating. You know, I watch young people and my own children, grandchildren, you know, how they interact with cell phones, and you know, you have apps like TikTok, which are designed just for just a few seconds to you know, and then you're just scrolling and. You know, it's funny, when I was a graduate student, I volunteered for a neurological study doing functional MRI. Because I needed money, so they gave me some money to put my head in a tube. And what was fascinating is they just showed images and then watch what happened to your brain. And it was almost like, you know, what happens on TikTok when you're scrolling through. There's just flashes of images and your brain kicks off. And what's fascinating is your brain is processing information, and it's these dopamine circuits are just firing in short bursts. And what that does, I mean, we've known for years you can actually train animals and you can train people to do things by this sort of behavior. You show them image after image after image of certain things, and you start training the brain to respond in a specific way. And so it's fascinating that we're allowing TikTok to rewire our children's brains, which is exactly what it's doing. So this stress and reward pathway, it's a real thing, right? Yeah. And you know, I mean, I saw it. I participated in a real scientific study where there was a monitor in the MRI, and they were just showing me pictures and then watching what parts of the brain were firing in response to these pictures. But it can just show you how powerful that is. In a neurological sense, it's not just a psychological thing where we're looking at it and saying, oh, you know, my life is not exactly like this but you're actually having it's having a direct neurological effect on the brain and the reward system in the brain. And that's why people get into this doom scrolling thing. Yeah. they just continually, they can't get off. They're watching reels on Instagram or watching TikToks, and it's this reward system that you're training in your brain, and when you take it away, there's withdrawal as well, right? And so you basically become addicted to it.
I mean, my kids, when they talk about turning on TV, they mean YouTube. TV has, and if you look at the TV shows that when you or I were kids versus what the kids are watching on YouTube, I mean, it's very different. They talk about it, and there's all these people that have studied like Coco Melon and these other things. I mean, the number of cuts that they do, everything is like rapidly changing. It's rapid reward for the brain. And like you said, it becomes this dopamine cycle where, okay, I need something to happen every couple of seconds. And if it doesn't, I'm not going to pay attention to it. Like I turn shows on that I watched as a kid, like Nickelodeon and other things, and my kids just aren't interested. They'll watch it for a couple minutes and then walk away.
They can't, their attention span, they've been trained to only focus for a short period of time. Yeah, it's crazy. And you know, the other thing that you brought up, I think that is also overlooked neurologically is the stress and anxiety. And these are things when you focus constantly on things that you're anxious about, you actually change your brain chemistry. And people don't realize that you can change the way your brain is functioned just by the thoughts that you entertain and the focus that you put on things. So things like stress hormones like cortisol can be elevated, circuits in specific parts of the brain, in the prefrontal cortex, in amygdala, they start firing differently. And that focus, if it continues long enough, it actually hardwires these patterns of anxiety and depression into the brain. And so when we have this combination of messing up the reward system by the new technology, and at the same time introducing anxiety and stress, it's just like the perfect perfect storm of bad things that could happen to your brain. And so, how do you counteract that? And I guess, what the flip side, you can do positive things as well with the exact same. You can take the same things and actually turn them into positive. So affirming thoughts, practicing gratitude, focusing on hope.
It's amazing how much our mind and our mindset impacts health. Like they've shown consistently, it doesn't matter what disease, even something as serious as cancer, how you feel about your disease and how you feel about outcomes actually has a real impact on it.
Yeah, it's fascinating that we call it neuroplasticity, right? Yeah. That our brains are plastic, which means they're moldable, they can be reshaped. And the brain tends to focus on tends to respond to what we put attention on. And so if our focus and attention's on negative things, then the brain's going to hardwire negative feedback into the brain. And if we focus on positive things, the same thing happens. It just feels like, that it's just the default and the easy thing is the negative stuff.
Yeah.
And I don't know why it seems that way, but it's so much harder to wire the positive stuff in than the negative. Yeah. And I'm not sure whether that's by design or what, but it just, and maybe it's because, we have for certain negative behaviors, they result in things that are dangerous, and so there's a stronger signal to say don't do that than things that are more positive, that it's less dangerous. I'm not sure. I mean, there's lots of research out there to try to figure out why.
And it's like we were saying before. I mean, the advent of technology really, where it is to the level today, has really boomed over the past maybe 30 years. And so changing the entirety of human history and all of these hardwired responses we have to things to something that's completely new and different. I mean, I feel like it's hard for biology to keep up with technology that can change so fast. And so I don't, like you were saying, why are we hardwired to have these negative responses or to remember those? But it's true. I mean, it's a lot more easy to look on the negative side of something and kind of think about that. And I don't know if that's a survival mechanism where, like you were saying, well, if this happens, then I can be hurt or I can be injured, and that can impact me. It can impact my family. And so it's better to think negatively about things to keep yourself safe. I mean, it's fascinating to think about. And I think they're, like you said, studying it to see really why that is the case.
No, it's amazing. So it's not just about external environmental, things coming from the outside. It's actually what we focus on inside of our heads. Yeah. And the stories that we tell ourselves, like in our own brain, we have things that we're reinforcing, and that changes brain biology and it changes brain function. And in fact, if you focus on certain things, it actually changes even the anatomy of your brain can change. We talk about plasticity. It actually physically manifests differently. So I think, when I talk to people know that I'm in the field with medicine and developing new medicines. Everybody will call and say, my kid's really suffering. What medication would you recommend? And so let's talk about the big question. Yeah. It is something that people turn to and say, because if you have a kid that's really struggling, and especially when they get to the point where, they're starting to have serious negative thoughts about, do I, harm themselves? Do they harm themselves or even having suicidal thoughts? I mean, that's an emergency level situation where you really feel like you have to do something. You can't just let it slide. So I guess at the end of the day, the big question, and there's a lot of debate about this. So what's the current thinking about, do antidepressants really work in children? Because there's a big question mark that, because developing brains are a little different than adult brains. I think it's pretty clear that in some and maybe most adults that are suffering from depression, antidepressants have an effect. But tell me about what you know about what happens in kids and how that's different with antidepressants.
Yeah.
BioHive is a nonprofit building, branding, and bringing together Utah's fast-growing life science ecosystem. Get involved today. BioHive's Women in Technology and Science community hosts events for anyone and everyone wanting to support women in life science STEM. And BioHive's Health Tech Hub community hosts events for those operating at the intersection of health and technology. Register for events and see what's buzzing at biohive.com.
I mean, so they've studied this pretty extensively. They've taken a lot of different clinical trials. They then take these trials and mix everything together and do meta-analyses and things like that. And first and foremost, so the reason why we run placebos in clinical trials, and especially in these, is they have a response.
Yeah.
So it can be as high as 60% in some of these trials that you give them a pill that has no pharmacologically active medication whatsoever, and up to 60% of people will feel better, especially in kids.
Yeah.
And so it's amazing how when you tell a kid something, they will believe that and they will think that. And so I think it's hard to do these trials because there's a difference between maybe 60 and 70% of improvement with the drugs, but in order to become statistically significant, they have to screen a lot of people. And so when you look at, we always talk about different statistical measures in medicine, number needed to treat, like what is the impact, all of these different things. And really, the placebo does a good job. The other one might improve a little bit, but you would probably have to treat hundreds of kids in order to really have an impact on one.
Yeah. And I think that, so I had the experience of, I had a company that was bought by a larger company. So I went to work for the larger company, and they did a lot in the area of neuro and psych drugs. And, so I would sit in meetings and watch the results of clinical trials, and it just blew my mind, that they'd show, here's what our drug did in terms of alleviating symptoms for major depressive disorder or whatever, bipolar disorder. And then you look at the placebo effect and think, oh my goodness, 60% of people respond to the placebo and 70% of people responded to the drug. And you do a big enough study, and that's statistically significant.
Right.
But the reality is there's just a few people in the treatment arm that are swinging that result, right? Yeah. So the way that statistics works out is the vast majority of people that see benefit are actually they would get the same benefit from the placebo.
Correct.
And there's a small percentage that actually benefit from the drug. So just like, we've talked previously, and we talk a lot about, drugs always have a spectrum of response. Some people respond better than others, and there's a lot of reasons for that. But in this case, I think, the evidence suggests that there's just a small improvement in a population. Yeah. So, but what that means is individuals are likely to not see a lot of improvement when you medicate them. And so it's really a challenging thing when parents come with children and say, hey, I need medication because my child's suffering and I don't want him to suffer. How can you, because we don't have good ways to say this is why some people benefit and why some people don't. We have a lot of hypotheses about that, but we don't have really good screening tests that I can say, hey, you're Prozac's one that has consistently shown,
and that's
a moderate
usually
benefit.
the best for kids.
For kids, it's
probably what you'll get put on.
It's been the most well studied.
Yeah,
but even that, it's moderate, right?
It's really questionable whether the person sitting in front of you is going to get an impact from it. And that's what's hard, is because we talk about these drugs like, oh, let's give them this. Well, we're ignoring all the different side effects that come with it. Yeah. And these drugs aren't benign. They're okay in the terms of like compared to some other medications. But I mean, you see weight gain, you see like the sexual dysfunction, you see a lot of different things that are real impacts for these medications. And then what do you do next? Well, you up the dose, and then, I'm on a higher dose, therefore I should feel better. Yeah. You feel better for a little bit, and then it gets worse again. And then you're just increasing the amount of side effects. I think we give so much like Zoloft in this country that you can find it in the water supply. Yeah. And so it's one of these where you keep increasing the dose, and while there might be a benefit, it's hard to measure exactly how much that is, because when you look at these tests, there are other things that are not medications that also improve it. People who start exercising, they feel better. Yep. They have increased scores on these tests. If you get enough sleep on the night before you take one of these tests, you will feel better than if you slept for 4 hours the night before. And so it's it's very hard. Humans are the worst test subjects, right? We can take mice, we can take all of these different things, control every single piece of their environment. But when you look at doing human studies, especially something as subjective as I don't feel well, or I'm suffering, or I am depressed, and then you're like, well, I'm giving you a medication that'll make you feel better. That works for most people just by telling them, hey, this is going to make you feel better.
Right. Just the anticipation that, hey, this is doing something.
Right.
And, these are, like you said, these are not benign drugs. They're affecting chemistry in the brain. They're affecting, most of these are serotonin reuptake inhibitors. And so they're affecting the levels of serotonin, which is a major neurotransmitter. We talked about, dopamine and serotonin are kind of the main neurotransmitters involved in mood and controlling the reward system that we talked about. All of that is affected. And the other thing we don't know, and you can't do a clinical trial on this, is put people on, when they're young, we're talking about preteen all the way through puberty and then their early adulthood being on these antidepressants, what that does to the development of their brain and how that changes their identity. I mean, you basically are labeling somebody as, I'm a depressed kid when you're taking medication, and that becomes wired into their brain, and so it can shape how they see themselves for the rest of their life. That this is me. This is who I am. I'm the depressed one. And so we got to be careful about medication. It can save lives. It can help people, but when it becomes the first or the only response that we have, I think we risk really masking deeper problems that like the trauma and family stress and bullying. We're not healing those things. We're just covering them up. Like it's just providing a Band-Aid for it's not getting at the cause.
So they have diagnostic criteria. The DSM-5 is kind of the book that they use to look at different like psychiatric disorders and things like that. And it's interesting because there are times where people are okay to have depression, right? They say, well, it's 6 months after a major traumatic event. And so the question is, well, why is it okay in some instances and not in others? Because I can only imagine if I look at somebody maybe who has job insecurity. They don't know where their next paycheck's going to come from. They don't know where their next meal is. I think I would probably have struggled with depression if that was the case there. Yeah. And so trying to remove this separately from the environment that somebody's in, or like we said, all the different stresses that kids have today, all the different kind of things that go on at school. Because I talk to my kids when I ask them, hey, how was school? It's fine.
Fine. Yeah,
like,
exactly.
And they go upstairs. I'm like, was it fine? Are they getting bullied? Is something going on? And so
that's just part of being a kid. Right? Yeah.
Right. And so it's hard to know exactly what is going on. And then when there are things that would make anybody depressed or feel anxious, like, well, is medication the answer, or should we try and correct what's making them feel depressed and anxious?
No, that's exactly right. Well, I think if we think about, some of the recent discoveries that are happening, we talked a little bit about, our own thoughts and our own focus can actually change brain chemistry. But another thing that I think is relatively new that we started to realize is that the way that our brain handles stress and we've talked about previously inflammatory responses. I don't think this is talked about enough in the context of mental health issues. We know that the same process that the body responds to fight infection and to heal injury, those pathways can get triggered by these stress and the remodeling process that's happening in the brain when people are focused on these negative thoughts and negative self dialogue that they have. And so we're starting to realize the immune response actually plays a role in this, which is kind of crazy that it actually plays a big role in these psychiatric conditions. So we know the elevated inflammatory mediators. So they're these little molecules or little chemicals that are produced by cells to communicate with each other. And we've talked a little bit about that previously in other podcasts, where inflammation is your immune system responding to these signals. Well, those signals are actually higher in people that have depression and anxiety. And so, we can show that chronic inflammation, even systemically, so if we have a systemic, meaning outside the brain, something that's happening other places in our body, that we can actually show that it will change neurotransmitters in the brain, will reduce serotonin availability, and can even damage neural connections. So, it's fascinating that mental illness is not just, it's not just, all in your head. It actually, your whole body and your whole immune system, how those tissues and cells are interacting with each other can actually change your mood and change your psychiatric health. And
it changes your physical health too.
That's right.
They have worse overall outcomes for different things. They did a very simple study where they gave people struggling with depression the common cold, and then took like a control sample. And not only did they have higher rates of contracting colds, they had longer periods of time and were more sick during those times. And so it, like we've said a couple different times, the role our brain plays on the rest of our physiology and our body is fascinating, and it can't be overlooked because, and like you said, I think inflammation plays a huge part in this. I think that there is an underlying component that we just don't think about or don't recognize right now. And there are a lot of smart people working on a lot of different things. So my hope is that we'll be able to understand better treatments. And because I guess another part of the issue that we haven't really talked about is we don't really understand what is going on in the brain of someone with depression. Like we always talk about, it's a chemical imbalance. Like, well, what chemical?
What does that mean exactly?
What does that mean? Because you can change serotonin one way or the other, and it will make people feel better. And it's like, well, what are we doing then?
Yeah, it's fascinating. I think it's still such an unexplored. Misunderstood. We just don't know. We know so very little about how our brain functions. And you think about all the inflammatory triggers that we're learning about now for the rest of the body. It affects the brain as well. So poor diet, lack of sleep, obesity. We've talked about how obesity is a chronic inflammatory condition. People that are obese have more depression. And we've always thought, they're just sad because they're overweight and they can't lose weight. But that's not. There's actually a connection. It's more than that, right? There's a connection to the inflammatory conditions. So stress and even environmental toxins that people are exposed to, all of those things are known to trigger inflammation. And all of those things can contribute to neuroinflammation, what's happening in the brain. And so prime the immune system to make the brain more vulnerable to depression and anxiety. And so when you think about, what you can do to start to try to address these problems. So lifestyle interventions matter a lot. When kids exercise, they eat right, they sleep. It's not just introducing discipline. And we used to think that, hey, they just are more disciplined, but it's actually more than that, right? All of those things will reduce inflammation, will improve their mood and improve brain function because you're lowering inflammation. And so it also, I think, explains why traditional antidepressants don't necessarily work in some patients when the root cause isn't just the neurotransmitter having a problem. If you don't get rid of the inflammation, it doesn't matter what you do to the neurotransmitter. And so maybe the people that benefit the most are the ones that actually have the least inflammation. And those studies really have not been done, right? They haven't stratified people and say, because it's been hard actually to measure inflammation in the brain to say, here's how much inflammation you have. We're getting better at it, but it would be fascinating to see that the small percentage of people that swing those studies in these clinical trials, you wonder whether the people that benefit the most are the ones that have that have the less underlying inflammation, which then changing the neurotransmitter concentration might actually result in a better effect. And so we do know there are subsets of people that do very much better than others. And in fact, the vast majority of people that go on these antidepressants, it doesn't help them that much.
And most of them stop them after a short period of time.
Exactly.
I have prescribed it to a handful of patients. I've continued prescriptions for patients. And I think even in like a short-term setting, you have something that is causing stress, anxiety, whatever it may be. I think they can be useful. I think they can help you feel better. But most patients don't want to be on them.
Yeah.
And if they don't feel like there's significant benefit, then they don't stay on them. And then B, like you said, it's one of these that it's so hard to study. There's so many underlying factors, and it would be great if we knew more. And I think that's probably where we are lacking now, is just the understanding. And biology is so much more complex than we ever imagined it to be. And there's so much more that we're learning every single day. And I mean, we were talking about this yesterday. We just understood within the past week the mechanism of one of our biggest diabetes drugs, metformin. Yeah. It's a 60-year-old drug, and we're just now starting to understand what it does. And it's amazing how many drugs are that way. And I think almost all of the antipsychotics and antidepressants, they work, but we don't really know why. Yeah. And as a scientist, that's a really hard position to be in, because you're like, well, it works, we just don't know why. And it's hard to improve something that you don't exactly know why it's working and make it better.
What if you could get rewarded just for being healthier? Meet Galvin, the company using the latest blockchain technology to reward you for taking care of yourself. They help with your mind, body, and soul like a personalized health assistant to track your progress and help you feel better. Galvin's G Plus app rewards you for exercise and assesses your mental health in under a minute using AI and over 2,500 voice biomarkers. If you're feeling off, G Plus gives you personalized power-ups, science-backed techniques to help you feel better fast. And here's the best part. When you prioritize your wellness, you earn crypto. Ready to level up your health? Use promo code GOODMED20 at checkout for 20% off. Download G Plus today at the Apple app or Google Play Store and start your wellness journey with Galvin. That's why I think the reality is we have not made good breakthroughs. We have variations on themes. All of the depression medication are just variations on the same thing. I mean, they go back to pretty old drugs,
like Thorazine.
And we really don't know what that does either, right?
No,
and so,
exactly.
So we just monkey around and say, oh, well, I changed this and I changed that, and you know, I get this effect. But the reality is we don't know why, and so that, like you said, it makes it really, really hard to make breakthroughs when the baseline drugs, we don't know what's going on. So if medication isn't the solution, and maybe, like I said, for some people it is, and I think that's clear. Yeah. The hard thing is knowing who those people are. Right. But you know, when we're thinking about what good medicine looks like in the case of mental health, what is it? And so we know that the lifestyle things like sleep, exercise, nutrition, those are core changes that everyone should make if dealing with. So if we can reduce stress hormones and inflammation, you're going to see an effect. You're going to feel better if you can eliminate. You
change your diet and start exercising, those go down.
They'll go
depression
down.
And anxiety levels go down.
You'll feel better. Yep. And so, you know, I think that the other thing that is becoming very clear is we do need to create boundaries around technology for children. I think letting children have full access at any time to their smartphones or to computers or iPads or whatever. Yeah. That you know, them being on social media, there's a direct correlation with how much time they spend on and how much they suffer from these conditions. So I think, you know, we need to create tech-free times. Yeah. Schools struggle with it. They try to do everything they can. I know I've seen recently there's schools that make people lock away their technology, you know, at the beginning of school, and they don't get those back until the end. The kids hate it, you know, and because they're addicted. I mean, they have a physical addiction to it, that they've trained their brain that if I'm not looking at this stuff,
you're taking this away from me. I'm not going to respond.
Yeah, well. I mean, that's where I get on my reward. That's how I feel good. And so I think we underestimate the power of things like personal and family connections as well, that eating dinner together, taking time to listen to each other, showing up to things that are performances and games, those little moments, you know, can help build resilience for children. And I think that's one of the things that I think is really missing is we've tried to eliminate struggle, and in doing so, we've created a generation that struggles more, right? Because we've tried to shield them from things like, you know, physical pain and suffering. And I mean, to be honest, in our country, there's very few people that go to bed hungry anymore. There's very few people, it's diminishing in we feel good about that because I mean, none of us want to see people starving and not knowing where their next meal is going to come from. I mean, those are horrible situations. Right. But in eliminating physical struggle, we've also created this kind of protection bubble around kids that, at the end of the day, struggle is part of development, right? Is being able to deal with the normal struggle. I read something recently. We went on such a big anti-bullying kick that nobody should be bullied. Yeah, and I don't think there's anybody that's like, oh yeah, you should definitely be
pro-bullying.
I'm pro-bullying. Yeah, that's a tough position to take, right? But the reality is, it's interesting that the data suggests that overcoming that type of adversity is actually an extremely important part of your mental development. And when we shield children completely from overcoming struggle, it actually it doesn't allow them, it doesn't equip them with a healthy way to deal with life, because life is a struggle. And it's not like once you get older, everything is sunshine and everything gets better. And I have a son that's just moved out of the house, and he's starting to realize the reality of life. It's like, I mean, everything costs money. Everything takes time and costs money. And you just don't, when you're a kid, you don't think about that because, everything's taken care of. So I think, part of being a human being, we shouldn't try to eliminate everything hard in their lives and eliminate hard emotions. It's trying to equip people with ways to handle, in healthy ways to handle them. And I'm not sure as a society we've done a good job at doing that. We've left a lot of parenting to smartphones, which is, I think, a really bad thing.
Yeah, no, I don't want to demonize technology because there are good aspects of it. I think the ability to access information that our kids have and things like that. But like you said, just setting boundaries on it. When my kids come home from school and they're like, "Can I watch TV?" and I tell them no, they're like, "Okay, I'm going to go ride my bike then." I'm like, that's so much better. Yes, go ride your bike. Like that's the best thing you can do. And I even look at something as benign as like FaceTime, right? You're like, well, it's good. They're able to talk to grandma or whatever. But there is something about having a face-to-face conversation with somebody, about making eye contact. You can't make eye contact at FaceTime, right? You're either looking at the camera or looking at the screen, and they're looking at the camera. You can't do both. And so they have shown that even eye contact like improves the way that you feel. It's something like that where it's not the same. It's not the same having a conversation. You might be saying the same words, you might be hearing the same things, but it's different than sitting in a room with somebody else or doing something like that. And I think that we have, like you said, we've made things so convenient and so easy that, I don't know, I think it's removed things that have made us human and these connections that we have with people. If you talk, I read a really depressing study that was like the average person over the age of 30 has maybe 1 to 2 people that they feel like they can rely on. Yeah. And if you're not married and your parents have passed away, then that might be 0. Yeah. And so it's these connections that we have with other people. I don't know if we're making them because technology has replaced other people in a lot of ways.
No, and it's fascinating that technology has connected us in ways we've never been. The world is such a smaller place. I every day I have Zoom calls with people all around the world. I jump on a plane, I can be somewhere pretty quickly, and relatively on the other side of the world in a day, right? Yeah. So the world's a lot smaller than it used to be, but what's fascinating is that people feel less connected and more lonely than they ever have. And you'd think, technology was supposed to solve all these problems. We can stay connected. We can, build. But at the end of the day, we're social creatures, right? I mean, we are not supposed to be solitary. Our whole biology is not. It's wired around us.
A community,
being in a community and living in a family, and when we get separated from that, we're fighting real biology. Yeah. And so we turn to the other side of technology is, well, just give me a medication that can make me feel better. Right. I mean, that's what we go to our doctor and say, I feel lousy, doc. Give me something that makes me feel better. Right. And in this case, medications can help in severe cases, but the benefits, let's be honest, they're usually pretty modest for most people, and the risks are real. I mean, we didn't even talk about a lot of these medications have black box warnings on them,
which increase your suicide
which means
risk.
There's something seriously at risk. So even if it increases suicide risk or suicide ideation, thinking about killing yourself, by 1 or 2%, which is what the numbers are.
Yeah.
I mean, it might sound modest, but that means out of every 100 people that take these, 1 or 2 of those people are going to commit suicide or think about committing suicide when they weren't taking those. And how widely prescribed those drugs are, that's pretty scary, right? To think about that. If it's 1 or 2%, different, that's
there's millions of people in the U.S. If you think about that, that's tens of thousands of people.
Thousands and thousands of people. So the bigger levers for us, I think, as we start thinking about this is, obviously we're very interested in inflammation. We think reducing inflammation systemically all through your body, specifically in your brain. We talked about ways of doing that. Therapy we didn't talk about, but therapy certainly plays a role. Being able to have somebody that you can discuss things that you're anxious and that you're worried about. I read a book recently that I thought was fascinating, that it was entitled "Don't Believe What You Think," right? That we're our own worst enemies. The most of the stuff that we stress about has no chance of actually even happening, right? I mean, we worry, what happens if this, if I lose all my money and they take my house away and I get thrown in jail and all. I mean, the reality is most of that stuff's never going to happen.
Sure.
And so we take it to the extreme in our own heads, and we create this anxiety that is detached from reality. And so being able to talk that through with people and get coping mechanisms when we start to get into that cycle, I think is part of good medicine. And then obviously diet and nutrition and exercise, as we talked about, those healthy habits really do make a difference. And everyone's, I go to the doctor, he's just going to tell me exercise and eat right. Well, because it's the right thing, right? I mean, it is the solution to so many things. So if you're a parent listening, we can't empathize more with you. We're parents. I'm a grandparent. I look at the kids growing up today, and it makes me scared for them to think of what they're facing. Different challenges than we've ever had, and a lot of them are self-imposed challenges that we've handed them a developing brain that's just a piece of clay that can be molded, and we're letting it get molded by stuff that we don't know even what the long-term consequences are going to be in the future. But I guess the best medicine that we can recommend is be present with your children and know what they're dealing with, and encourage good behavior, set boundaries, be there, show them that you care. Encourage healthy habits. And if your child's in real danger, if they come to you and say, I'm struggling, it's not time to monkey around and to say, well, they're going to get better. They're just, you should get professional help. If your child does say, hey, I'm struggling with this, call 988. It's the Suicide Crisis Lifeline. And get professional help, because we don't want to see anyone take their own life. And it's happening. It is, I think, for certain segments of ages of kids, it's the number one cause of death. And I mean, that's just crazy to think taking their own lives is the number one reason that certain ages of children are actually dying is because they kill themselves.
I mean, your kids went to a high school where it made news, not for good reasons, because they had a string of suicides there.
And part of this is that, there's this social contagion side of this as well. Right. That the number one risk factor for committing suicide is knowing somebody that committed suicide. And I mean, that's just crazy to think that this stuff is almost like an infectious disease. Yeah. And so, really getting ahead of this and staying on top of our kids are saying they're struggling. And the question is, are we listening? And are we willing to change the way that we live to allow us to have our children thrive? And I mean, at the end of the day, that's good medicine, right? Yeah. I mean, that's the best medicine. And I think, unfortunately, we get so caught up in the busyness of our life, we ignore a lot of the warning signs and a lot of things that we can do to change. So mental health is it's a serious issue. It's a real crisis. And I wish there were magic pills that, I wish we could save every one of these kids that go so far that they decide to take their own lives. I sincerely wish that I had a magic pill that could fix it. Yeah. I'm working on something that could eliminate neuroinflammation, and maybe that's going to have an effect. We're actually seeing in animals that even things like addictive behavior, fascinating that things like gambling addiction, drug addiction, there's an inflammatory component to that. Yeah. So we're learning a lot of this stuff, but unfortunately, it's still a lot of undiscovered biology out there. We're working every day to try to create new medicines, but we'll just tell you that the best medicine that we can prescribe in this case is, that we try to promote is healthy habits and healthy, positive feedback that we possibly can. And don't forget, make sure your kids sleep well. I think we're learning more and more that sleep is so important for adults. And I'm the worst one. I sleep probably the least amount of anybody that I know, but it really does make a difference, especially in younger kids. So we talk about good medicine and mental health. I think sleep, nutrition, positive experiences, and positive family interactions are the best things that we can do. Yeah,
I totally agree.
Well, hopefully that's helpful. Hopefully we gave you some ideas about something that I think a lot of us, unfortunately, are struggling with. Thank you for tuning into the Good Medicine Podcast. Please, if you like the content, please subscribe wherever you get on Spotify, Apple, or on YouTube. It helps us keep producing these podcasts. And appreciate all your support. Thank you. That's it for today's episode of Good Medicine. Thanks for joining us as we explore the science and stories behind health, medicine, and innovation. If you enjoyed this conversation, please subscribe to our YouTube channel. That's a great zero-cost way to support us. In addition, please click, follow, and leave a review for the podcast on Apple and Spotify. If you have questions or comments for me, please put them in the comments section on YouTube or reach out on all social media platforms at Good Medicine. Links are in the description. The best way to support the podcast is to check out the sponsors of the show. You can do this by looking at the links in the show notes. That's it for today. I'm Dr. David Beers, and we'll see you next time.